Greetings everyone. I am Dr. Amoolya G, working as an assistant professor at the All India Institute of Speech and Hearing, Mysore. In this module, we will learn about the stages of speech and language development and also have a brief introduction to speech and language disorders. A child cannot talk as soon as it is born. They learn talking in an order from most basic, easy and relevant to most complex combination of sounds and words. Please remember that the stages and ages that we learn here is based on research on a large number of children. However, every child learns things at their own pace. But knowing about the age at which a child learns different things while learning to speak is important. Only then we will be able to detect if any child is not developing as they should and take necessary steps to help them. There are two main skills that children learn while learning to talk. One is comprehension, that is understanding what is being said, and another is expression or talking. Generally, children learn to understand before they learn to speak. In the first few months of life, a child may start to recognize mother's voice and show happiness when being talked to. The child is hearing, seeing, and learning to respond to familiar voices with their cries, smiles, and voice. They may make sounds like ba ba ba, pa pa pa, etc. around 6 months of age. They start understanding meanings of many common words such as fan, plate, etc. and understand many common phrases like clap your hands, wave bye bye, etc. When the child is around the age of 1 year, the child starts to combine simple sounds and makes small meaningful words such as amma, papa, nana, etc. They now also may understand more common words used in their surroundings. In the next few months after 1 year, children start to point and indicate their basic needs with baby words. You may have heard children say susu for pee, mammam for food, etc. By around 18 months, children have around 50 meaningful words in their vocabulary. They understand the names of most things around them and may even point to them. For example, they may point to eyes, nose, mother, fan, teddy bear, etc. when asked. By the age of 2 years, children understand most instructions. They can do simple things that you ask, such as bring your shoes, keep it under the table, etc. At the age of 2, children start to combine words, sometimes words with gestures. They may say, Mama give, not this, etc. They also start understanding short, simple stories. As they grow to 3 years, children can listen, understand, sequence, and do two or more instructions correctly. For example, switch on the light and close the door. The child's vocabulary increases day by day. They start connecting small sentences to make short stories. By around 4 years of age, children's sentences become longer with more words. They can now make new sentences as per their need. Now, the baby words are no more there, and the speech is mostly clear to everyone. Learning of words and its use in sentences and various social contexts continues to teenage. A child learning to talk is a very complex process, but most of us take it for granted because it happens automatically for most children. There are many conditions that may cause problems in speaking. Few of them are hearing loss, where a child cannot hear as well as others, intellectual disability, where a child cannot learn to speak because of less intelligence, cerebral palsy, where a child may not be able to sit or stand or walk like others and develop problems in speaking because of poor muscle strength. Autism spectrum disorders, where children are not able to learn to speak because they have difficulty interacting with people. Attention deficit hyperactivity disorder, where a child's ability to concentrate or pay attention is so poor that the child is not able to learn to speak. Some children with this problem may constantly be running around and do not sit at one place. Our brain controls most of the actions we do, and it controls of our speech and language also. So if a child suffers from any kind of brain damage, the child may suffer from speech and language problems also. Some children are born with cleft lip and palate. Such problems in the structure of the mouth can cause problems in learning to speak. Other problems that may cause problems with speaking include stammering, children mispronouncing words, children having difficulty learning to read and write, their voice being different may cause voice problems. Apart from all this, some children just have difficulty in learning to talk, even when we cannot identify any particular reason for them speaking late. In other words, they can hear well, see, pay attention, and have good intelligence. Yet they may not speak as much as other children of the same age. All these conditions may require consultation, detailed evaluation, and treatment by a qualified speech and language pathologist. We hope you are now aware of the various stages in which a child learns to speak and also the most common speech and language disorders. This brings us to the end of Module 1. Thank you.